statement.
Make a statement?
Yeah.
Well, I was at the Arctic Club early on this evening.
At about 9:30 p.m.
Yes, when two women come in drinking with my boss. Little later after, we went out because we were going somewhere. The girl attacked with acid. And ice pick stabbed my friend and burned her.
Some go-go girls have arrived with a co-worker who's been hurt in a fight.
Why did she stab her?
Because she fight over man. Fight over man. You can imagine that 39-year-old woman
I can fight a little 20-year-old girl over man. We don't like war, but if the war comes, we have to war. Because we are working. We are working and she come at our workplace and try to disturb us and our job. So we have to fight back. You like that side? I see. You like that side. Come. Make you tell them what you feel. Hurt me.
See ya?
But I got a private doctor tomorrow.
Yeah, because them nasty down here, sir.
Jamaica not run good. Jamaica want money.
Jamaica don't send people to fight.
Jamaica send people to fight, but the government not run Jamaica good. Because they see that they can't stitch a girl on here. So government not work.
Hello?
It a pain you? Yeah, 45 must. I know it a get hot, not it a get stale.
Hold it up on it, earth.
What the doctor said, Nikki.
Jamaican girl.
Well, we go inside and the doctor said that she cannot get stitched tonight. They only can cover it. So she have between tonight and tomorrow to get it stitched.
And those things are slackness.
And those things are slackness. This hospital is supposed to stitch the patient when them come in.
True.
We want justice.
We want justice. We want justice.
KPH admits people from all over Jamaica. It never turns sick patients away. But the violence in the community surrounding the hospital has led to overcrowding on its wards.
Where is this bed?
Apart from an acute lack of clothes. Still has a stuff.
Sister, you have any clothes for her?
Senior resident Conrad Lawson and his team are on their morning ward round.
So he is awaiting surgery as well, as is 3/4 of the ward. We don't have enough time to operate on all of our patients. So we ask you to exercise a little patience and wait with us. Okay? As soon as we possibly can, we need to get this operated on so that we can get you to the hospital. Okay?
I'm calling them to make a match.
Me alone can't do that. Me alone. This is a ward designed to hold 45 patients, and we have already had 92 patients on this ward alone. And right now we have about 65 patients. Capacity is supposed to be 45. We have nowhere else to send them. The buck stops here. Hence the reason why you see so many beds in the corridors. We have had beds behind the station. We can do no better. You do as much as you can with the facilities that you have, and you hope the man upstairs is seeing what is going on and gives you some relief in some way.
The man upstairs is Chief Executive Donald Nelson. He returned to Jamaica after 30 years working in the NHS and the Royal Navy's medical service. Nelson's experience in Britain makes him well qualified for the job, but not everyone was happy with the appointment of an outsider.
I don't want to increase the workload of any member of staff, but there's means and ways of efficiency, and I think sometimes we stretch out. Christmas comes to Rose Lane again.
What's that?
Gunshots.
Mr. Bombastic. We want is a bombastic, romantic, fantastic lover.
Trevor McCartney, Senior Medical Officer. Dr. McCartney has been at KPH for 21 years, and he's the most powerful man in the institution. He's held most of the key posts in the hospital, including Donald Nelson's job.
She call me Mr. Bombastic, tell me fantastic. Touch me on me back, she says I'm Mr. Romantic. On
I have had the opportunity of also being Chief Executive Officer for 3 years, and therefore able to have an overview of the significance of KPH, where it ought to be, where it is going. I've also been fortunate enough to have obtained the confidence of the people who work here, so that if I say something, they will realize that I'm saying it only for the good of the institution, and they are quite willing to follow.
The SMO here was the acting CEO when I came in. I particularly do not know what the SMO's administrative training is, if any.
All right.
But let me make a statement.
I'll go over there now then. Okay.
Doctors are not the best administrators.
Whose box that good is this? Yours? Hello.
Yes, sir.
Who sent you this? Your birthday? You're joking. It's next week? I didn't know that.
As SMO, McCartney is the most senior doctor at KPH. It's vital that he has a good working relationship with the chief executive.
Is the nurse in office?
But the two men don't always see eye to eye.
We have situations in the hospital where patients are literally lying on stretchers because we have to provide things in chairs. And I'm just wondering, is that humanly right?
This is worse than humanly wrong.
Right. Now, couldn't those patients be seen and be sent home with a promise of being reviewed next week or the week after?
If the patient is sick and needs to be in hospital, they can be sent home.
But we do not have the nursing staff. We do not have the holding facility, i.e. the bed. How then do we put patients in these situations and expect them to get better?
A patient in hospital, even sitting in a chair, can be monitored.
By whom?
Can obtain, even in the limited, you can bear me out. Even in the limited state, it is better than putting them in a situation where nobody has any medical knowledge whatsoever.
We have a situation when we lose our visitors at 6 o'clock. And they go down and they see their mothers or their brothers or their sisters, and they think of us as mere or, butchers in the hospital. How can you keep our people like this?
Are you willing to take the responsibility of an inquiry into the death of somebody who comes here and is sent home inappropriately? I am not prepared to take responsibility. If a clinical decision is made knowing that somebody ought to be in hospital, you know somebody ought to be here, and you make a decision that tell you you'll be abandoned by the government, you will be abandoned and vilified. That's a judgment decision which is incorrect.
I'm not
for expediency.
What I'm saying, those cases, I'm not saying.
But you make it sound like there are people who don't really need to be in. You need to walk. Come with me and walk in the water every day. I've never seen people so sick in my days. You need to walk and see. I'm going to give an example. I'm going to give an example of how the male ward looks. Good morning, sister.
Excuse me.
We are having a problem with overcrowding. Would you say you have patients who can go home?
Well, we're trying to make the patients as stable as possible before we send them home, but we have a problem of overcrowding.
Would you say that your admissions from casualty are inappropriate, or most of the people who come in have to stay?
Most of them are appropriate, but sometimes you have a couple of patients whom they can't make out what's going on.
So what do you do with them when you get them?
We try to investigate as far as possible and see if they need admission. And then
you send them home if they don't?
Once after we have settled them and sorted out the problems, we discharge them and follow them up at the clinic.
This lady here looks very ill. She's in a chair.
Yeah.
But I can't send her home. I can't really look at that kind of person and say,
this is good.
He just can't do it.
Something has to be done about the overcrowding. We can't continue to. It's a bit
499.
Sad.
That's a good one here. The one sitting there. Is that by your name?
It's the only word I can use. Since I'm on camera, I won't use this terminology as I would normally. Having been involved in hospital management or hospital life all my working years, and having been living abroad, where I've never seen conditions like this, and I've traveled as far as India, I wouldn't be happy to see my brother or my sister or my helper at home brought into KPH and treated. They are getting treatment, but in the conditions under which they are getting treatment, I think it's terrible. This should not be. This should not be. There were days when ministers, prime ministers were admitted to this hospital. I remember as a boy, reading that Mr. So-and-so, or member of the House of Representatives as it was admitted to Kingston Public Hospital. Nobody wants to, unless it's an emergency, wants to come to KPH.
A new patient is about to be admitted onto the overcrowded ward. Dr. Bushman is looking for a place for him to sleep.
We have to board a patient here. Sometimes in the night we have to board a patient here to sleep.
Patients sleep here?
If we can. And after we just did a minor procedure, like we do even tenor repair under these conditions. And lucky and surprisingly, the infection rate is low, even though you do it under unsterile conditions. It's very hot in here, very hot. And you get people to clean up the floor, but in the night it's difficult. So this is why it looks like that. Even if it's very hot, I don't put it on because it's to blow all the dust in the wound. So the patient and the doctor has to suffer sweat. The AC not working, and no windows here. The water not working. I'm not really frustrated, but it's kind of annoying this evening. The usual process.
Roach, you have my bed in here. Roach. Roach, you can't sleep. Roach.
Roach all over the night. Every part in the cupboard, if you put on a cup, a spoon, anywhere, roach. And as you can see, this man is an attraction and can't move. I have to brush them off on his face.
Look on the curtain over there, sir. You see it? It's when I get harassment by roach. I have to brush them like this with my foot and my hand, because I can't ease up my head there.
What do you do with the sheet?
Cover up my face and my towel, I have to use it. Two something I have to use. My towel like this and my sheet and cover up like this.
Dr. McCartney arrives in Antigua for the test match, West Indies versus New Zealand.
This is the other side of KPH SMO.
Yes, it is, definitely. The real side. This is that Jamaica, right? You feel at home in the night. We are definitely going to win. It's a matter of the margin of victory. We're definitely going to win. Definitely. We have a Jamaican captain. What do you expect?
I consider myself a full-time civil servant. It would be nice to have the senior management team of this hospital full-time, including Dr. McCartney. How much is the SMO's post and position worth in this hospital is not for me to say. All I'm saying, it would be nice to have full-time staff.
Go, Jimmy, go. Yeah, 6. Hey, 7. Man, run the field.
Mr. Nelson doesn't know anything about medicine, and therefore he has no idea whatsoever how people function. He has not yet understood our system. I think it's a matter of time. Maybe he understands but does not accept that how it is. When you first have the handle on administration, you have tremendous dreams and goals and ideas, which, if you are not careful, you'll get carried away and become frustrated. But after doing it for 7 years, you become pragmatic, and therefore you look at it a little differently. You don't become cynical, but you realize that the goals that you may set yourself are not realistic.
I have had time to lose my cool at the attitude of some of the staff. I said, but you have been here for 20 and odd years, and you have watched this once nice institution go down to it. Didn't you put up a resistance? Didn't you beg, plead, march on the Ministry of Health or the government and say, you can't do this to KPH?
Wish your boss. Oh, God. Jesus.
Dennis Rainsford has burnt his skin trying to unblock his toilet with caustic soda. It's not the kind of case which takes priority here.
Wanna get it? Which part?
Lord.
Go in that room around here and wash off yourself. Doctor, can you speak to a nurse?
Casualty staff aren't paying Mr. Rainsford much attention, and he's a little confused. The cameraman directs him to the washroom.
Stop aside, don't know.
Let's wash your,
Yeah?
put your head on the tap.
In the water?
Yeah.
Acid is often used as a weapon here, and acid burn victims are commonplace. Washing with water is a standard treatment, but Mr. Rainsford hasn't yet seen a doctor. The best advice he gets comes from two members of the cleaning staff.
Get acid.
He should never wet himself.
Them tell him to come wet
himself.
Wet
Acid
himself
burn.
and cool him down.
Yeah, man, acid burn.
Yes.
You see whenever time acid burn you, and if you could have just
Water.
get to wipe it off, wipe it. Just
water
ease.
and then you put on the milk.
No, you see from the water touch it, in great, in feel
Get
it
a
all.
fit burn, yes,
In
and that's
so you
wrong.
put water upon it while it stay like that. If you are just
No, if you never put the water,
just easy,
you'd
man.
like
I see
no.
throw away on my hand, you know. I see throw away on my hand. And the most thing I could do is grab my rag and wipe it off. And see me hand here, just wipe it off.
I want cast it.
No, what the problem is, the toilet wall block. Yeah. And it end up that I do everything to clear it. Yeah. And I go and buy some gas and turn on. Throw a lot of water and try to plunge it. This is something like I'm just stick a matches and it just explode up for me. Yes, that is it.
Oh dear.
I'm not saying about it.
You have to come back since I said you to cool off. Come back and sit down. Jeez, yeah. Some things can happen to people.
Jesus.
Mr. Rainsford is in pain, but at the moment, staff are too busy to help. About 40 minutes after arriving in casualty, Mr. Rainsford received some medical attention from Nurse Needham, who'd just come on duty.
Well, right now we can just clean it up with some normal saline, get it cool, and cover it up with some sulfur tool. That's all we do for him now. Nothing else. And some painkiller, some analgesic.
Finally, the patient is seen by a doctor.
You don't feel no pain, right? 4% superficial burns. There's no damage to eye, nose, mouth, or the ear. There's not much loss of tissue there. It's just superficial mostly.
Never go into your nose, right? Oh no. I don't go into your eyes, right?
Lucky guy. And it's with caustic soda. Yeah. Lucky that it never went into his eyes. Because that can be real painful. Cause a lot of damage to the eye.
And I'm beginning to think, do we really care? You make pleas and, nobody hears. Or they hear, but there's no action. And you feel very, very incompetent. You're unable to do what you know should be done. I'm in this situation now. I know what should be done. I know what should be done. We must treat our sick with more respect.
Since this film was completed, work has begun on a £12 million program to refurbish the hospital. The casualty department, operating theatres, and the orthopedic ward have already been upgraded.